Hello, welcome to Interdependent Study, our podcast where we engage in the learning and unlearning work for collective liberation. I'm Aaron.
And I'm Damien. Thank you so much for joining us today. Each week, we'll bring something new to the table and discuss our thoughts and feelings about it through the lenses of who we are and where we can go for a more just society.
We want Interdependent Study to be a space where we're always learning with one another. And Damien, you're up this week. What are you bringing to the table today?
Yes, sir. All right. So I have brought a feature from our friends at Inquest to the table today. The piece is called For the People's Health, and it was written by Cristian Farias and published in Inquest late last month. So it's still a relatively new piece, and I would definitely encourage folks to check it out. I mentioned this last week when I introed this piece, but Farias is a senior editor and a founding editor of Inquest, which is really cool. He's also a legal journalist and scholar, so he brings a lot to the table here. And I thought this was a really great piece. It is centered around the idea that abolitionist organizing and public health are intertwined and should be intertwined, and how organizers working in the arena of public health abolition have been and continue to advocate for decarceral projects and abolitionist initiatives that center and advance our well-being above all else.
Yeah.
And so the piece offers some great examples of public health abolitionist organizing efforts from all the way back to the 1960s and all the way up to today, including some great work being done on college campuses like UCLA to train future public health leaders who are committed to centering abolition in their work and as a public health strategy, which is really cool. So yeah, there's so much in this piece. Again, I really enjoyed it, so I'm excited to get into this. What did you think of it?
Yeah, I really appreciated it. And they named one of the articles we read just last fall,
Yes.
I think, Beyond Do No Harm, Health, Justice, and Abolition, which was in the Forge organizing site, and which introduced us to Beyond Do No Harm from Interrupting Criminalization, which they talk about both pieces in this article. And I liked it because it got into more and different depth in this piece than in that piece we read on the Forge.
Right.
And it was just really great to also get some more insight about the Panthers and the ethics that influenced their choices for the healthcare programs that they offered and implemented in their communities.
Yes.
And how those programs were tied into other things happening in the 70s, like with the Young Lords offering similar healthcare things in their neighborhoods, and how the current movement for abolition is directly tied to public health.
Right.
As you mentioned, they're intertwined.
Yeah.
There's a quote from a few paragraphs into the article that highlights this connection really effectively. At its core, abolitionist public health sees carceral institutions and practices as antithetical to public health. If jails, prisons, and detention centers are death-making by nature, as Mariam Kaba famously observed, then it follows that the public's health is ill-served by continuing to invest in carceral structures that make people and their communities sick, as abundant research has shown. And so there's just that quote, I think, really set it up for me to really see the connections to all of this. And there's more in the article about how public health organizations are doing more work in opposition to the prison industrial complex because they see prisons and police as antithetical to actual public health.
Right.
Like you mentioned in UCLA and some other public health professional organizations and those kind of things are also doing that work. So yeah, I thought this was a great piece and a great introduction into, or reintroduction to some things and connection to some deeper things that are going on too across the whole sphere of public health.
And across the country, right? Absolutely. Yeah, that quote was really great. I highlighted it. It stood out to me. It really makes it clear why abolition and public health are connected, as you said. And I'm also glad that you mentioned the Black Panther Party and some of the abolitionist healthcare programs that they offered back in the 60s and 70s. I'll be honest, when I first found this article and opened it up, I was really intrigued to read this piece because the banner image at the top of the article is a picture from a free sickle cell anemia testing clinic in Oakland that the Black Panthers hosted in 1972. And my mom suffered with sickle cell anemia. So I was struck right away. I was like, I want to read this, whether or not I'll bring it to the show or not. I want to read this. But the Black Panther Party was laser focused on the people's health, especially as this piece points out, they were really disappointed with the slow progress of the civil rights movement in the 60s. And one of the things I really loved was this description of what the Black Panthers set out to do. So Farias said, quote, "Understanding this revised narrative of the Panthers, as Alondra Nelson calls it, helps us contextualize how the party went on to establish, among other imperatives, a nationwide network of free-for-all health clinics, the People's Free Medical Clinics. In these alternative healthcare facilities, patients were offered care at no cost, found safety from medical discrimination, received political education, and had other needs met by trusted health experts and lay people alike. Importantly, the Panthers recognized that social health, that is, the community's broader well-being, called for more than simply healthcare access. Local residents could receive assistance from a patient advocate, a party member or volunteer, on such matters as physical health, housing issues, and legal aid, Nelson writes. In this way, the clinics were also bases of operations for the Panthers' wider Serve the People agenda. Like the Panthers' free breakfast program for kids, the clinics were both sites of service and a way of doing politics by other means, end quote. And so I love all of that. This idea of community care in service of people, I think, was a brilliant model for how we can help and serve and take care of each other and our communities in really beautiful ways. And, that to me, because that was really early on in the piece, that served as a great example right out the gate of how abolition and public health can and should be connected.
Yeah. So much of, I think, what the Panthers did in the 60s and 70s was, to borrow a phrase from Olufemi Taiwo, was captured by the elites.
Yeah.
Through both like the nonprofit industrial complex and also through the school system with a free breakfast, free meal programs that they were running. So it's interesting to see this group that was so vilified to have their leaders thrown in prison or assassinated in cold blood in their apartment in Chicago, have the programs that they were implementing be captured in this way, and re-implemented in a different, sanitized manner by the government,
and one that continues to connect those programs to the carceral system, right? Absolutely.
Yeah, and means testing and all that other stuff, which we'll get into more with Solidarity.
Yes, absolutely.
We'll talk about that next week. Spoiler alert again. One of the really interesting points in this article that makes total sense, but I hadn't thought about it before just because I haven't thought much about public health beyond like very broad topics such as vaccines and COVID protections.
Yes.
Right. So the fact that public health as a field in the United States is entrenched with the government, so the view that they have is very influenced by governmental notions of what's acceptable and correct.
Right.
As many things in the country are that are connected to governmental institutions like education. So the article points out how, because of this very deep association, public health is connected to systems of coercion and control through the criminal punishment system, the prison industrial complex. And the article quotes Bita Amani, who is a social epidemiologist at Charles Drew University's Department of Urban Public Affairs. So Bita says, public health is a tool of the state to maintain order.
Wow.
And Amani points out that public health, quote, arose to compensate for the absence of socialized universal health care in the United States and other public measures that keep people healthy. So she goes on to call this organized abandonment.
Yes.
So, which I think we've mentioned on the show before, and I think it's a concept that abolitionists talk about a lot as we look to history and see the intentional defunding of life-giving institutions across the last 50 to 60 years and before that, but also in this concentrated manner in the last 50 to 60 years with the rise of neoliberal capitalism and the neoliberal turn that our government took. Many thanks to Reagan for that, and Nixon before him. And anyway, when was the last time I brought up Reagan? It's been a little bit.
Been a minute.
Anyway,
I'm proud of you.
The actor. And I think so. Back to organized abandonment. I think it's a super important thing to grasp as a foundation for abolitionist movement. So much so that that's my application. I'm going to talk about organized abandonment for application. Yeah.
We're going to put a pin in that.
I'll come back.
I'll come back. Hope I can stand the suspense here. Yeah, no, I appreciate all of that. I think one of the things that I also appreciate about this piece is how it made me think more about how our public health system is connected to systems of coercion and control, as you point out. It's unfortunately an institution and a system like so many others in our country, for sure. So that's why this work that we're talking about, abolitionist public health organizing, is so important. So I guess, all right, since you're going to talk about organized abandonment later, I'll highlight an example of organizing work being done to combat it. Farias shared what an organization called the End Police Violence Collective is doing, and I thought this was really great. So he said, quote, "The End Police Violence Collective, which organized members of the American Public Health Association to draft and adopt a policy statement naming the harms of carceral systems as a public health crisis, had to work hard behind the scenes to educate skeptics that abolition and public health are, in fact, two sides of the same coin. Far from destruction," the collective wrote for Inquest in 2022, "abolition is about disrupting systems that create or compound harm while establishing or reinforcing health-affirming ones in their stead, ultimately creating a world where people have what they need to live healthy and safe lives in their communities."
Imagine that.
Imagine that, right? And I think what's great about that statement, beyond the total and complete truth in it, is that it has been used by a lot of public health agencies and organizers and professional organizations, like you mentioned, across the country to advance the importance of centering abolition in public health and how we can best serve real people and communities, which I think is just so incredible. So it started with this policy statement, and it has been used in countless ways. And so that's a really beautiful thing to see.
Yeah, and I think it's so great to see it name how much harm these systems are doing to public health, particularly as we think about the organized abandonment of not having universal health care. And connecting back to the Panthers' concept of social health, of it being more than just access to health care in the Western medical sense of a doctor, but holistic well-being, like what is going on in the community beyond whether or not I'm recovering well from an illness or managing my health well.
So it's important to be named. Absolutely.
So another thing that I think is really important and tied into a deeper understanding of abolition is how tied to individualism we are in the so-called West.
Oh, wow. Yeah.
We think about our individual choices and behavior, and they rule the day in a lot of ways. We ignore the systems that we're in that determine which choices we even have available to us.
Right.
Which ultimately limit the choices that we have.
There it is.
And we don't always notice that they're limited because we only see the things that are in front of us. So anyway, the article quotes Carlos Martinez, a professor at UC Santa Cruz. He says that the materials and methods in public health instruction are individualist, which the article says places the onus on individuals rather than systems to improve health outcomes.
Right.
And then Dr. Martinez goes on to say, quote, "The way that public health is taught in most programs continues to be focused on individual behavior change instead of systems change, even as concepts such as social determinants of health have entered the mainstream." And the article goes on to say, quote, "He pointed to a study showing how public health textbooks, almost without exception, are framed around behavioral fundamentalism, the idea that health is guided by behavior and personal choices rather than social, structural, or systemic factors."
Right.
So this concept of individualism is so ingrained in us in the West that we don't notice it as foundational bias within a field like public health until we do a study like this to point out how this all works. We don't hear it as a bias, right? Because it's just the water that we're swimming around in. And so I really appreciate that he pointed this out. And I think it reveals how much public health instruction and lots of fields
absolutely
across the United States are guided by this foundational belief in our individual behaviors versus understanding the systems that we're living in and how they influence so much of the choices and factors of our health or our education or our careers or whatever it is. But in this case, health.
Absolutely. Yeah. I saw that piece and it made me think about that study, and maybe would be worth reading it, even though we don't work in public health. But just this idea of what analysis and what application could come from that, I thought might be really useful, or just for anything interesting to read about. But that idea of the social determinants of health is really important to me and stuck out to me. And as a spoiler alert, it might be something I'm going to talk about in just a second here in application.
Hey there, folks. Sorry for the interruption, but we wanted to invite you to join us over on Patreon.
Yeah, we're so excited to be on Patreon and be able to create some additional content and opportunities for us to learn and unlearn together.
That's right. We'll be rolling out some new ways you can join us in our collective learning and unlearning over the next few weeks.
So you can join for free and get some regular updates from us. And we'll also have paid tiers available as well with extra content available each month.
You can find us at patreon.com/interdependent study and join us today.
That's right. You can join right now at patreon.com/interdependent study. Okay, now back to the episode.
Patreon.com/interdependent study.
So let's shift our conversation to that place. Let's talk about how this piece and our conversation about it apply to our everyday lives and work. This piece really made clear to me the myriad of reasons why abolition and public health are connected and must be connected. And as we've talked about in previous episodes, when we talked about public safety, I think it's imperative that we think about public health in broader ways than it's traditionally been thought of, or as you just mentioned, how it's been taught. One of the statements in this piece that made this clear for me was this, quote, "Within the U.S. government, the World Health Organization, and state and local public health authorities, there is widespread acceptance that preventing disease and death by addressing the, quote, social determinants of health is a cornerstone of public health. These determinants, which can mean the world to people who lack them, include economic resources to meet everyday needs, such as nutritious food, housing, and transportation, quality education and job training, access to health care, clean water, air, and access to public spaces, and an environment free of state violence. Failing to fund these priorities, the thinking goes, leads to failed societies. Social injustice," the WHO Commission on the Social Determinants of Health noted in a 2008 report, "is killing people on a grand scale." And that's a big statement. And social injustice is killing people on a grand scale. But I think there's a real need to think about and address these social determinants of health to give folks the opportunity to live more healthy lives and free lives. And I love all of the things in there, including an environment free of state violence. And so we think about the connection of public health, again, to these carceral systems. That connection is there, and that's a problem. And so all of these things to me, this idea of these social determinants of health, I love and appreciate those, and that's the application that can be taken from this.
Yes, I love that particular quote. I also, as I was thinking about what I wanted to talk about for this episode, I had that highlighted as well. I thought about one little clause that they have in this statement.
Oh, yeah?
About economic resources to meet everyday needs. And then it goes on to say food, housing, transportation, education, job training, healthcare, clean water, air, access to public spaces, and environment free from state violence. Should those continue to be economic resources? That's so I went down a little thought experiment rabbit hole as I read that quote initially. I was like, I understand that the reality is these are economic resources.
Right.
And I think an abolitionist world, which, the World Health Organization is probably not talking about specifically, but an abolitionist world, these aren't economic resources. These are foundational human rights.
Yes.
Having access to food and housing are necessary
to survive.
And they impact your health when you don't have access to them in a number of ways. So, yeah,
So not so much economic resources, more fundamental resources.
Right. It was just one of the things that stuck out to me in that statement. On the whole, love that statement. I think it's great.
Yeah.
And should these continue to be this?
Ooh, very good.
That's the
Okay.
So anyway, great application. I love that quote. I think it's so astute.
Yes.
My application is from a link in the article that connects back to an article that's in the Journal of Social Science and Medicine called Organized Abandonment Under Racial Capitalism, measuring accountable actors of structural racism for public health research and action.
Wow.
So it's an academic journal article.
Yep.
And this is a quotation which helps define organized abandonment in the context of public health and was referenced in the article and helping to define that. for the author here. So the journal article says, quote, organized abandonment starts with intentional disinvestment of certain neighborhoods, primarily low income, Black, and other communities of color through racist policies and practices that results in the flight of economic activity and jobs, abandonment of public services, dilapidated housing, environmental degradation, and underemployment. This racialized disinvestment is part of racial capitalism's functioning and contributes to subsequent extraction, revenue generation, and carceral control of these communities. And jumping back to our main article in Inquest, it says, quote, social welfare programs have been shown to prevent criminalization, contacts with the criminal legal system, and reincarceration. So this organized abandonment is an investment in the prison system, not just because that's where the funding is diverted to, but because the absence of funding here generally leads to people having more contact with the criminal punishment system.
There it is.
And so it's an active investment in police and prisons, and it's an indirect investment in police and prisons, because when you don't invest in the life-giving institutions, it sends people into the death-making institutions, as Miriam Kaba has taught us. So, you know, and this is not just about what we do or don't have access to, but a recognition that the things we have access to are an intentional choice of government abandonment. Absolutely. The defunding of education over the last several decades is a specific choice. The lack of funding for public health is a specific choice. And these choices point to the fact that we could make other choices that are actually investing in life-giving institutions. And I think that's foundational to understanding and accepting abolition as a process that would benefit all of us, a process and a destination that would benefit all of us.
That's brilliant, my friend. One of the things what you said made me think about was just what we saw during COVID as just an example. You talk about the defunding of education being a specific choice, the lack of funding for public health being a choice, and where we saw that impact, our communities, who that impacted during the pandemic, I think is a real life recent example of what you talked about here. And so, this organized abandonment concept is a big issue for public health, and one that I'm glad we got to learn more about and talk about. So great application, my friend.
Thank you.
All right, well, let's move on to homework. How do we want to continue our learning once we leave the table today? I mentioned this at the start, but this piece highlighted some great examples of public health abolitionist organizing efforts taking place across the country right now. And so to name a few, the Abolitionist Public Health Student Network, the Health Not Punishment Collective, the California Coalition for Women's Prisons, the Human Impact Partners, and there's so many more. And so I kind of want to click through and learn more about these organizations and the great work that they're doing, and see what more we can learn from them directly in the work that they're doing in the streets and with health professionals across the country. What about you?
Yeah, I think it's always great to learn from organizations who are doing the work.
Doing the work.
My homework, I'm bringing back Carlos Martinez, the professor at UC Santa Cruz, because I want to read the book that he co-edited, which is a collection called All of This Safety is Killing Us, Health Justice Beyond Prisons, Police, and Borders, which just sounds like a great way to continue my own learning about health justice and abolition more broadly. So
All of This Safety is Killing Us. What a title.
What a title. That's so good.
Very good. Okay, so another book, huh?
Well, at some point, eventually.
Yeah,
add it to the list.
Add it to the list.
Ever growing.
I love it. All right, well, I think we're going to wrap up this conversation and talk about next week.
Yeah.
And you're up next time, my friend. What are you bringing to the table in our next episode?
Well, as I alluded to earlier, and I think we talked about, I don't know, a couple weeks ago. We've alluded to this a few times.
Yes.
I'm bringing our next book to the table. It's called Solidarity. It's by Leah Hunt Hendricks and Astra Taylor. And we actually got to see them talk about this book with Olufemi Taiwo a couple months ago.
Yes.
And I've been eagerly awaiting the time when we could bring this book to the table to talk about it. And this is a description from the publisher's website. Solidarity is often invoked, but it is rarely analyzed and poorly understood. Here, two leading activists and thinkers survey the past, present, and future of the concept across borders of nation, identity, and class to ask, how can we build solidarity in an era of staggering inequality, polarization, violence, and ecological catastrophe? Offering a lively and lucid history of the idea from ancient Rome through the first European and American socialists and labor organizers to 21st century social movements like Occupy Wall Street and Black Lives Matter, Hunt Hendricks and Taylor trace the philosophical debates and political struggles that have shaped the modern world. I've read a good chunk of this, and I'm excited to get into a discussion of it because there's so much to talk about. There are so many great examples of the transformative solidarity that they talk about throughout history that are mentioned a little bit in this blurb, and lots about how it can be further improved as a guiding philosophy for people organizing for a world we deserve that does not intentionally abandon us through organized abandonment.
Yes, I'm with you. I'm so excited to talk about this book, and I'm also a few chapters in, and I feel like I'm highlighting like crazy. And there's, I think, solidarity as you call it, a guiding philosophy, is a really powerful way to do this work and to guide what we're talking about and doing. And so, yeah, I'm very much so looking forward to talking about this next week. So lucky you getting to bring it to the table for us. Just how the calendar worked. All right. Well, with that, we want to thank you all for joining us today. You know what we want you to do, but in case you forgot, please follow, leave a rating and review, share our podcast with the people in your life, follow us on social media, including Instagram and TikTok, check us out on YouTube, and sign up and join us on Patreon to get notified about any new things we've got going on behind the scenes.
Yes, thank you so much for listening. Remember, it's not about us, but it is about all of us. And we'll talk to you next week.